tell me why mental health counselors in particular should consider making telehealth, telemedicine a part of their regular practice?
Mental health providers from a variety of backgrounds, I believe, really need to embrace the emerging digital technologies for many reasons. One includes improved access for their clients, particularly in terms of reaching those that have difficulty having access, either for geographic or any clinical matters. And secondly, the ability to access providers with expertise that they need is markedly improved. So there's another good reason for access.
Yeah, I think that telemental health will continue to be useful in the future, even as the pandemic, as we all hope, begins to ease. I think it's with the skyrocketing utilization of these technologies, I think we've seen that people who didn't think it would really work well have found that it actually does work well. And as Brad mentioned earlier, it will continue to provide easier, more convenient access for patients who perhaps are coming from much further away, so they won't have to travel in for an appointment. Maybe it's better access, easier access for people who have difficulties in getting transported, even if they live locally. So I think going forward, this will be part of it. I think we're going to be moving into sort of a hybrid model of in-person care and care via telehealth technologies.
So the top three things I really hope that the attendees come away with would be a better understanding of policies and regulations, and not necessarily in-depth knowledge, knowing where to go to find this information, knowing how to set up their offices to provide a professional level of care, knowing how to understanding the literature base to complete an encounter, so that when they're done with this training, they have greater competence, but I think more importantly, greater confidence in being able to provide a high quality professional encounter.
Yeah, I think I would have said pretty much the same things, that I would want the attendees to know what areas of legislation and policy and regulations are impacted by or impact providing services by telehealth, and to definitely to be aware of some of the resources that they can go to obtain extra information, but also additional training and support for providing services.
How do you make sure that you're providing a safe encounter? What kind of systems do you need to have in place should the client or patient become suicidal, or you need to intervene? How do you go about thinking through the putting in a backup system in place in case you need to call 911, in case you need to admit a patient? All of these types of things need to be thought through ahead of time, and you need to have a plan in place. So we will touch on those matters as well.